In here today. Okay, so today I'm going to give you kind of an overview of breastfeeding, the benefits of breastfeeding, and then how we're doing as a state. Then we're going to go into some of the sectors and initiatives that we work on at the state level for breastfeeding. So we're going to talk about the maternity care settings and medical offices. We'll go into a little bit more about NICU and the use of human milk fortifier, as well as WIC. Workplace and childcare initiatives, and then last we'll just sprinkle kind of throughout our resources and advocacy as well. So in the Early Childhood Obesity Prevention Unit, which I'm a part of, and I'm the breastfeeding specialist for the Colorado Department of Public Health and Environment, and within this unit we really use a health equity approach in our work. We use community involvement to really help us understand and remove barriers, which help to share our programs, practices, and policies. So we know that any breast milk is good for babies, no matter how much a baby receives, but really to get the maximum benefits according to research, a baby should breastfeed exclusively for the first 6 months. And exclusive means no other food or drinks provided to the baby before 6 months. The goal is really to breastfeed for at least 12 months. That's our goal in the United States. The World Health Organization's goal is to 2 years and longer. So all of ours, the AAP, the American Academy of Pediatrics, recommend that mom and baby breastfeed as long as they wish after. The main goal is to do exclusive for 6 months and to get to 12 months. We know that breastfeeding provides a lot of health benefits through our research by reducing the risks for mom and baby. The most notable ones are for mom, reducing the risks of breast and ovarian cancer. And for baby, when a baby is breastfed, we see a reduction in SIDS, or sudden infant death syndrome, by up to 50% or more. So we know that breastfeeding is really protective against SIDS. There's also lower respiratory tract and ear infections, a lower risk of diarrhea and stomach problems, a lower risk of childhood obesity, which is why we really work to promote it throughout the state and at state initiatives. And also that's the main focus of the CDC as well in promoting breastfeeding, is for childhood obesity prevention. So breastfeeding benefits moms and babies, but we also know that there's a lot of really good benefits to the childcare professionals themselves, as well as the community and environment. Breastfeeding babies, it can help make babies less fussy often. It's easier digested as well. Their diapers tend to smell less stinky, so that's good for childcare providers and others as well until you start those solid foods. For mom, there's a lower risk of blood loss. It could help them lose weight. And it could save time because there's no prep needed for making formula or preparing the water for formula or any of the other steps. You can breastfeed anywhere, even during emergencies. For the community, studies show that it lowers healthcare costs because babies are sick less often. And so moms and dads also tend to take less time off work. So it's good for business in that way as well. It saves money. So the research estimates that if 90% of the US population breastfed exclusively for the first 6 months, we could save over $18 billion in healthcare costs and save about 1,000 lives every year just by breastfeeding. There's also less waste. So breastfeeding is a renewable resource. We don't have to use any of our resources to make breast milk. We don't have to package it in any way. There's no waste from it. So it's definitely a lot healthier for the environment as well. And breast milk's really, truly amazing. So breast milk contains nutrients, vitamins, growth factors, antibodies, hormones, and a lot more that is not found in formula, and actually could never be found in formula based on how formula is manufactured. The biggest thing are the antibodies. So we always like to say that colostrum, or baby or mom's first milk, is actually baby's first immunization. So it provides a lot of antibodies that mom makes, including when mom is sick with a cold or anything else. She can actually transmit those antibodies to her baby through her breast milk. We also know that breast milk actually inhibits bacterial growth. So it inhibits and limits bacterial growth. We know that when bacteria is found in breast milk, it slows down the growth dramatically so that it cannot multiply and become hazardous. And really, breast milk really is based on supply and demand. So the more milk that's removed from the breasts, the more milk the breasts make. So our recommendations are all major medical organizations recommend breast milk as baby's first and optimal first food. Recommend, as I said, for at least 12 months, if not longer, if mom and baby wish. And then the goal is for 6 months exclusive. And our goal really in the state of Colorado is focused not so much around the initiation or the beginning of breast milk, but really around the exclusivity and duration. So trying to remove many of the barriers that are in our society that could stop a mom from breastfeeding or stop her from breastfeeding exclusively. So as I mentioned, in Colorado, about 90% of babies are breastfed or start breastfeeding. So that's our initiation rate. Anywhere from 23 to 35%, these ranges kind of fluctuate annually based on our CDC results, are breastfed exclusively for 6 months in the state of Colorado. And about 40% breastfeed in Colorado for at least 1 year. So this just shows you here, the first column are the Healthy People 2020 targets that the state, that the federal government sets every 10 years. And so these are the metrics for breastfeeding. And then the next column is the US national and then Colorado. And those are based on the CDC National Immunization Survey. And their most recent survey just came out last week. And that was for 2015 births. So it's a 3-year birth cohort. So we're always delayed in getting the results. But we can see that we have now met all of the Healthy People 2020 targets, or nearly met all of the 2020 Healthy People targets in the US, which is fantastic. In Colorado, we had previously met and exceeded all of the national averages. That exclusively through 6 months kind of dropped this time, although it was not statistically significant, and I'll show you that on the next graph. However, I really want you to focus on the far right. So this is a different data set. So this is our WIC data. So it's not from the immunization survey, but it's from our Colorado WIC data. And this just shows that we have pretty good initiation rates in our lower income moms. But our lower income moms really experience a lot more of the barriers to continued and exclusive breastfeeding. And so we see that their duration rates, that at 6 months and at 1 year, really drop dramatically. And then their exclusivity rates also drop as well compared to the general population. So this just kind of shows those same results, but over time. So we've had steady increases in the number of moms who have started breastfeeding in Colorado. And then as well as our duration rates, they do fluctuate a little bit. The one that fluctuates the most is that bottom green line, which is the exclusively breastfed at 6 months. So for some reason, it tends to go up and down, but again, not statistically significant at this time. So some of the barriers to breastfeeding are really, social norms. So in America, we had the pendulum had swung and we went back to in the 70s. And so formula was really heavily pushed. And if you were going to do the right thing for your baby, you fed your baby formula. And now we're kind of shifting back to that breast milk really is evidence-based to provide more health benefits and more protective factors to babies, and that lasts into adulthood as well. So now the goal is to try to get more people aware of that, and so that they are more accepting and supportive of breastfeeding. That kind of goes along with the lack of knowledge. So whether it's your employer who has a lack of knowledge, your child care provider, even your doctor. There's also a lack of support. So really for these moms to be able to continue to breastfeed, she needs support. So when she returns to work or school, she has the support from her employer. Or if she returns to her physician, that her physician isn't just promoting formula use, and that the physician is actually supportive or can refer her to a lactation consultant. The lack of maternity leave that's paid or any kind of paid leave is also detrimental, especially to our low income moms. Oftentimes they have maybe 2 weeks of time off, and that's not even enough time for mom's body to physically heal before she would have to return to work, let alone the fact that she would also have to have an employer who's supportive enough to provide break time, to provide a space for her to pump. So the fact that we force our moms to return to work and not have any time off with their babies to learn and grow together as well is also detrimental in the US. A lot of our healthcare policies and practices also are not supportive of breastfeeding. We've slowly been working to change those over the last several decades, and they are getting more supportive. The Affordable Care Act does help. There are provisions now that in private insurance, they have to provide a breast pump. It's not defined on what level they have of pump they have to provide. So whether it's just a manual pump that might not be useful in that mom's situation, It doesn't define that, but they also have to refer to lactation support. So there are supported practices that are changing. It's just the implementation that's still an issue. Marketing by infant formula companies is always a challenge as well. It's a multi-billion-dollar industry, and they target moms in all different ways. And research shows that whenever a mom receives a free sample of formula, that their breastfeeding exclusivity and duration rates drop off dramatically. So the research really shows us that those infant formula companies know what they're doing, and they know how to get into the hospitals and provide free gift packs. They know how to send them to mom to get into the doctor's offices, because they know that once a mom starts on a certain brand of formula in the hospital, that she'll stick with that brand forever. And then worker school is another barrier as well. So not having a supportive employer, not having a supportive childcare provider, or the school not allowing her time to pump either in class or to leave class to pump. So disparities are definitely another issue. Racial and ethnic minorities, especially African Americans, tend to have the lowest breastfeeding rates in America. And it's also, African Americans tend to have some of the highest health disparities as well. And they also have the highest rates of infant mortality. The infant mortality African Americans are up to 7 times higher than whites. And so that's definitely concerning. And breastfeeding is another way that we can try to reduce infant mortality. And again, it's trying to get past some of those social and cultural norms and trying to increase education and support for these moms too, of all races and ethnicities. And also, you know, lower income workers also tend to be hourly workers that don't get the same kind of breaks and flexibility with their schedule to take breaks. And we'll talk a little bit more about work as well later. So this is the Pregnancy Risk Assessment Monitoring System. This is actually a CDC survey that's administered through the State Health Department. And we are able to add our own questions onto this survey that centralize around hospital practices, as well as looking at breastfeeding initiation and duration. And so this graph just shows over time of moms that were surveyed. The red lines are non-Medicaid moms, and the blue lines are Medicaid moms, moms that are on Medicaid. The solid lines are from 2013, which is our most recent data for this graph, and our dashed lines are from 10 years ago, or 10 years prior, 2003. So we see that we are closing that gap between the solid red and solid blue lines, that we are getting our lower income moms to reach higher levels of initiating breastfeeding. But we see that the blue line tends to drop off in duration much faster, especially around that 2-month mark where it drops from 60% down to 48%, which is a significant decrease. So we know that our, and you know, we don't really see that same drastic drop with the red lines, our non-Medicaid moms. So we know even through our data that our Medicaid moms are at a higher risk of not continuing to breastfeed and do have a lot more barriers that might prevent them from breastfeeding. So in Colorado, we really focus on breastfeeding as an early childhood obesity prevention. And it's one of the state's winnable battles is for obesity prevention, and part of that, a component of that, is breastfeeding. And so we have several initiatives that we really focus on at the state level that go down to local public health and then out to other communities as well. So this graph is from the Surgeon General's call to action to support breastfeeding from 2011. And then I've just kind of circled where we really have an influence at the state level. So local and communities focus a lot more, but we work directly with hospitals and other health professionals, with childcare providers, with local and state WIC office, with employers and supervisors and work sites. And then we also work with the advocacy and state agencies as well. So maternity care settings and medical offices are definitely an area that we really want to target, because we know through research that if moms get good support at the start and even prenatally, that they're more likely to succeed at breastfeeding. This is a new graph that came out from the World Health Organization that shows the 10 steps to successful breastfeeding, which is part of the Baby-Friendly Hospital Initiative. So the Baby-Friendly Hospital Initiative is a global health initiative that was created by the World Health Organization and UNICEF back in the 90s. And it is implemented worldwide. There's over 22,000 sites worldwide that are baby-friendly designated. Different countries kind of manage it differently. So oftentimes the federal government will manage the baby-friendly designation process. So like the Philippines, they've mandated all their hospitals in the Philippines would be baby-friendly designated. And the federal government mandated that and helped them achieve that status. Now, of course, we have a lot more maternity hospitals here in the United States. And so here in the United States, it's actually mandated by and governed by Baby-Friendly USA. But all of them involve implementing the 10 steps to successful breastfeeding, which are evidence-based to improve maternity care and practices, as well as breastfeeding results. So they really center around number one is hospital policies, ensuring that the hospital actually has its own policy that is supportive of breastfeeding for employees and for patients. Staff competency is one of the hardest for hospitals that are pursuing Baby-Friendly to achieve. They have to train 80% or more of their staff that directly have contact with the mom-baby unit to have breastfeeding support, so that if it's the middle of the night on the weekend and mom delivers and she's having breastfeeding complications, someone there is there that has been trained on breastfeeding that can provide support. And there also has to be prenatal care as well, so there needs to be prenatal education. So anyone who's providing prenatal education through the hospital setting has to also be trained on breastfeeding to provide that information prenatally. Evidence also shows that the more mom hears about it prenatally and prepares to breastfeed, the better her breastfeeding success. Care right after birth. So the big thing is placing babies skin to skin. We also know that that is a great practice for helping to normalize babies' blood glucose, the body temperature, their respiration. So it's got a lot of really good health benefits just by placing baby on mom's skin to skin, or even on another caregiver, dad or anyone else who's in the room. And that includes C-sections as well. Supporting mothers with breastfeeding, not providing supplementation of formula unless it's medically necessary. Rooming in as well, so that moms and babies stay in the same room so that they can learn their baby's cues and learn when to feed their baby. And as well as that they're actually at the breast more often, so they're stimulating a good milk supply in those first few days. Responsive feeding, again, looking at the baby's cues. Not providing any pacifiers or bottles or nipples or artificial nipples that could take away from breastfeeding, essentially, and that aren't needed for a medical reason. And then providing discharge care. So that's really a lot of where their initiatives come into play too. Hospitals really need to have that warm handoff. So they need to have community support, that there's a breastfeeding support group or a lactation consultant or someone else in the community, whether it's within that hospital or not, that they can hand it off to say, okay, now that you've discharged and your milk's finally come in and now you're experiencing all these problems, that mom has somewhere that she could call and actually get support. So when we go back to our prams, we actually asked moms if that were breastfeeding healthy breastfed infants. So we have 100% initiation rate here. We asked them if they experienced 5 of these 10 practices. And these were like the 5 that they would most noticeably know about. We didn't obviously ask, do you know if your hospital had a policy? But we asked, you know, did baby room in with you? Did baby receive a pacifier? All of those things. And we found that when mothers said that yes, they received all 5 of these practices during their hospital stay, we see a 2-month longer duration in these moms' breastfeeding success. So I always like to point this out to the hospitals to show them that the hospital work does not just influence their initiation and get them off to a good start. It actually impacts them throughout their breastfeeding journey, essentially. And if we provide that good support in the hospital, we can get moms to breastfeed for a lot longer as well. So back in 2013, we created the Colorado Baby-Friendly Hospital Collaborative. So this is a collaborative of 23 competitor hospitals, essentially, who joined forces in this collaborative to really, truly collaborate and share tricks and tips and information on how to achieve baby-friendly designation. So in the US, through Baby-Friendly USA, they have what's called a 4D pathway. There's 4 different phases. It's really 3, because the first phase is kind of discovery, where you're just looking into doing it. Then you pay a baby-friendly fee, you get all this information in portals, you get audits, all these different tasks that you have to complete. It usually takes hospitals 3 to 4 years to achieve baby-friendly designation, and then they have to maintain it after that through quality improvement projects, and it's just an ongoing kind of staff training and improvement initiative for their hospital. So it really does take a lot of information and support from the hospitals themselves. So I facilitate this group, but since I'm not a hospital, I can't give really that TA that another hospital can provide to a neighboring hospital to say, well, how did you overcome this with your staff? Or how did you implement this step? And so it's really kind of a state level. I just say I'm the operator. So I'm like the eyes and the ears, and I just connect everybody together on who can best help each other. We do provide training and technical assistance in the form of quarterly webinars, and we have an annual in-person networking workshop, which the hospitals always love to send people to so that they can network and really start sharing those tips and tricks. We previously, in our CDC grant, because this is CDC and MCH grant funded, right now it's only MCH grant funded, but we have a grant out for CDC grant, so we're hoping that we get that. But it was previously also financially funded, so we were able to give hospitals a one-time stipend to help offset the cost of baby-friendly fees and to help them develop that continuity of care so they had a discharge in their community, either a support group or something they could do the warm handoff, or also for staff training needs as well. So we're really excited. We now have 16 designated facilities. Prior to 2011, before the collaborative started, we only had 3, and they served the majority of patients that were private insurance and white. And so now that we have the additional 13 members, we're now up to 16 designated facilities, and we have 11 additional members who are in various stages on the pathway. So we now are at 43% of all of our live births in Colorado occur at a baby-friendly designated facility. So this is great because that means our moms that are choosing to breastfeed, since over 90% of our moms are choosing to breastfeed, to start breastfeeding, at least 43% of them are delivering at a hospital, or 43% of the babies are being born at a hospital that has the support in place at the hospital level to provide the most optimal breastfeeding support for these moms. Our projection is that by 2020, we hope to have around 50% of all live births. We also are reaching a greater percentage of our Medicaid paid births. Over 40% now are at a baby-friendly designated facility. So we're reaching more of those low-income moms to provide more support for them as well. And then that's just a breakdown of where our hospitals are. We have 10 urban hospitals, 5 suburban, and 6 rural. And then the other thing to really point out too is that we really, those that are serving, that are designated now and that are part of the collaborative actually have greater ethnic and minority representation, a greater percentage of Medicaid paid births. So they're reaching a lot more of our moms that have a lot more barriers as well. We also found that as hospitals go along the pathway to achieve baby-friendly designation, that their C-section rates drop as well. So that's kind of another health benefit. And really, we like to think of baby-friendly really truly is a population level health benefit, like health program. And it really is a quality improvement, health equity. There's no bias if everyone's trained that every mom that delivers gets baby placed skin to skin and every mom gets a lactation consultant to come in. There's no bias of someone coming in and going, oh, well, she's African American, so we're not going to provide her with support, because she's probably not going to want to breastfeed anyway. So it kind of eliminates all of those things for the most part and tries to level the playing field so that there's a health equity approach in this maternity care. So nationally, there's over 530 facilities and over 25% of the births nationwide are now at a baby-friendly designated facility. The Healthy People 2020 goal was only 8.1%, so they've definitely blown that out of the water. But a lot of that has to do with certain states have legislation that actually require designation. So California has actually mandated that all maternity hospitals achieve baby-friendly designation or follow the 10 steps by 2025. So that's definitely helping to push hospitals. In Colorado, we don't really go for the regulations as well. So we are mostly just pushing through kind of hospital competition now at this point. And we really want to increase the patient awareness too. So while we're still talking about the hospital, we'll talk a little bit more about the NICU. So we know that preterm infants and infants that are in the NICU are much more medically fragile. There's neurodevelopment concerns, there's growth concerns, they're more likely to be readmitted to the hospital later. They're definitely a much higher cost as well to the healthcare system. The estimates are up to 13 times higher cost for a preterm or NICU baby compared to a full-term healthy baby. And their nutritional requirements are also extraordinarily high, especially even after discharge. So oftentimes, the way our healthcare system is set up now, we want to get moms and babies out of the hospital as fast as possible. And often, mom might not have enough means to take care of the baby, enough nutrition at that point to really provide to the baby, so they'll just put baby on formula. But there's much better options that we'll talk about that as well. So these NICU babies also need a lot more support. So do the families as well, especially when they're discharged, they have a really high protein and energy needs, as well as minerals that aren't usually received in just breast milk at some of these levels, especially if it's a very low birth weight. And there's also neurocognitive development issues as well. But human milk is by far, through the evidence, the preferred choice for these very fragile babies. We show that it reduces the incidence of readmission, and it better meets the nutritional needs of the babies compared to infant formulas. So the readmission rates are lower, and we know that it also prevents bacterial infections as well, especially necrotizing enterocolitis, which is NEC, which is very costly and causes many health problems for the babies and can even lead to death. And we know that just simply switching to donor milk or using breast milk in a NICU, you can almost eliminate NEC entirely in infants. So we look for human milk fortifiers. So if these infants have a much higher protein and calorie need than mom's milk can provide, but we know that breast milk is the best milk, we now use human milk fortifier, which is essentially an infant formula that's been concentrated down into a powder or liquid form that cannot be used on its own. So it cannot provide full nutrition on its own, but it's added to breast milk to boost calories, protein, and some of the minerals in a safer level. So previously they were using formula sprinkles, is what it's called, where you just sprinkle some formula on the top to try to boost the calories. There's 2 recipes. They usually try to get to 22 or 24 kilocalorie per milliliter. And so there's healthcare guidelines that were developed through a NICU RD group through the state that's developed specific healthcare guidelines to try to educate NICU neurologists and other staff members when they're prescribing, that they would want to prescribe human milk fortifier over formula sprinkles or over formula at all if mom has a good milk supply. So WIC, the Women, Infants, and Children program, does provide human milk fortifier now, because their whole goal is definitely to try to support the most vulnerable women and children in our population and make sure that they have the best nutrition. And so with more moms choosing to exclusively breastfeed, I've been hearing a lot from different hospitals that the moms don't want to have formula. They don't want formula sprinkles. They don't want to be on formula at all. So if they can use their own breast milk and they have a good supply and access to a pump, then human milk fortifier really is the best way to go. And so WIC can provide the human milk fortifier on a 1-month supply, because we want to make sure that the baby's being looked at by a physician. Babies should only be on this for 12 weeks post-discharge and not any longer. And they should also have their labs monitored, because you can get too high levels of calcium or other minerals that can cause problems for babies' organs as well. So WIC does provide that, as well as pumps and other breastfeeding support. So this table shows you the differences between human milk alone is the first column, human milk that's enriched with formula sprinkles, essentially, human milk with human milk fortifier at that 1 to 50, and then human milk with human milk fortifier at the 1 to 25. And so the red means that it's below the estimated nutritional needs. So when you have this very low birth weight infant with these additional needs, human milk alone does not meet these needs. Human milk with sprinkles also does not meet the needs. But once you throw in the human milk fortifier for these really high need babies, we are now reaching and meeting their nutritional needs. So as I mentioned, WIC is the Supplemental Nutrition Program for Women, Infants, and Children, and it's a federal program that's administered through state health departments. And so I am the WIC breastfeeding coordinator for the state and help local agency WICs to provide breastfeeding education and support. So WIC provides different breastfeeding education and classes. They also provide nutrition education as well. They also provide food vouchers for nutritional foods. There's support groups for breastfeeding that are available. WIC provides a variety of different pumps, including hospital-grade multi-user pumps that can really help moms in need or that are having an issue. There's also a peer counselor program. We now have a peer counselor program statewide that's a texting program. So no matter where a mom is in the state, if she's on WIC, then she can have a peer counselor and can text back and forth questions and get referred to a lactation consultant if needed. And there are also many of our WIC clinics, especially in the metro area, have IBCLCs or that level of lactation consultant support as well, directly in the WIC clinic. So WIC has many different resources. This is just an example of one. We right now have a magnet that's like this, that this is the breast milk storage guidelines. And so this aligns with the USDA released new guidelines, and they're in line with the CDC, although they don't completely match yet. But they're a little bit on the more conservative side than a lot of what people will find in their pump. Like their pump manuals will often come with storage guidelines and such. And so these are the storage guidelines that we provide for WIC moms and any other moms to just show them how to safely store breast milk if they are pumping. So once a mom leaves the hospital, then she usually turns to her physician or her healthcare provider for her next questions. So if she doesn't receive that kind of discharge support, oh, you have breastfeeding questions, here's who to talk to, she'll tend to go to her physician or her healthcare provider and ask these questions. The issues that we run into is that breastfeeding is not required training for any physician at this time. So there is work at the national level to try to make this part of medical school training, but right now it's an elective. And ideally, we would like for pediatricians, family practice, and OBs to all have breastfeeding training, so that if mom has any contact with any of those healthcare providers, that she can receive support. So the medical office, it's really the trusted source I was saying. That's where mom wants to go. And then if they have a lack of training, they might be providing information that might not be supportive of breastfeeding, and they might not even know that they're not being supportive of breastfeeding. So Boulder County, through a grant that I'll talk about later, created a toolkit to essentially create breastfeeding-friendly medical offices. So it goes over policies and practices, provides resources and such that can really point out to a physician and a healthcare practice on how they can be more supportive of breastfeeding. So this is the cover page of the toolkit, and it has a self-assessment. And so this is something that, a patient could even present to their physician's office and say, hey, have you seen this? Did you know that this exists? And, you could try doing the self-assessment and see where you land if you're breastfeeding supportive or not. It talks about policy, what should be in their policy that's supportive of their staff members and their patients, staff training, patient education, environment, and continuity of care. So the environment's another big role. So I kind of mentioned earlier a little bit that if mom receives a formula gift packed in the hospital, that oftentimes she will end up using that brand of formula, and her breastfeeding success actually dramatically decreases if she gets a free formula sample. And so there's displays often in pediatricians' offices with free coupons, free baby, diaper bags, all kind of free supplies that they get with the baby formula information on it. And I really like to say that these little free samples are like a gateway drug. So they're sitting there telling mom that just in case you don't think you are going to be enough and that you're going to make enough, and just in case, just try me once. And then once you start using formula, you tend to lose your supply, and then it just goes downhill from there and you end up being full formula fed. And so the research also shows that if you receive a formula gift pack, or now what the new thing is that a lot of hospitals have banned formula gift packs to be in the hospital, is that now anytime you register for baby products, that you receive a free thing in the mail of formula. And so now research has come out and looked at that and said that, yep, same thing, that if you receive that free formula in the mail, that your breastfeeding rates also tend to decrease dramatically as well. So we know that it does have an impact on breastfeeding rates, having this formula free. So we don't tell physicians that they shouldn't have the free formula samples or have them available in a pediatrician's office, have the coupons, but don't have them in common public view. Only give them to those moms who are already formula feeding. Don't give them to a mom who's breastfeeding and who might need it down the line, kind of thing. So it's really trying to just change the practices and habits of the environment as well. The other thing I always like to point out is nowhere else in the hospital is it allowed for a drug manufacturer to come in and provide free samples to patients, or have access to patients, or provide marketing material to patients. It's unethical and it's not allowed. And so the only place this is allowed is for formula manufacturers to come in. And so that's also part of Baby-Friendly Hospital Initiative, is that they have to follow the World Health Organization's International Code of Marketing of Breast Milk Substitutes. So it's essentially that you won't be getting free drugs, essentially, a free formula. And nowhere else in the hospital is the food free. either. So it's essentially they have to pay fair market value for all the infant formula that they have in the hospital. So in Colorado, with our PRAMS data, we now see a dramatic decrease over the last 15 years or so in the number of moms that are reporting they did get a formula gift packed in the hospital. There's many states who have a ban the bags movement, and they've gotten all of their hospitals on board to no longer provide free hospital samples of formula. So what you can do to kind of be an advocate and to empower and increase support would really be to speak up. So talk to your physician, ask your physician if they have a need, if they have the knowledge, if they would like to know about the toolkit and learn more about how to be more supportive. Ask your, if a mom's pregnant, have her ask the hospital, are you baby friendly? Are you pursuing baby friendly? Because more of that patient satisfaction is really what hospitals base a lot of their policies on. So if more moms are asking and requesting for baby friendly or going to deliver at a hospital that is baby friendly because of the designation, then that's really good feedback for those hospitals to realize that if they want to stay on board and stay up to date and get the patients to come to their hospital, that they will achieve designation and provide this added support for moms. And another way is to join coalitions. So there's the Colorado Breastfeeding Coalition, and there's also a lot of local area coalitions throughout the state that we have listed on the coalition's website as well. So one of the other main barriers too for moms is if she doesn't get that good support by her doctor and from her birthing experience, is then returning to work and having to place her baby into childcare as well. So we know that women are actually the fastest growing segment in the workforce, in the US workforce, according to labor statistics. We also know that returning to work actually negatively impacts both the initiation and the duration of breastfeeding. So if a mom knows she's going to return to work and she has to return to work soon, oftentimes moms will think, I'm not even going to start breastfeeding. I won't even do that for the next 2 weeks. I'll just start with formula and we'll just make it easier. And so we know that it really does negatively impact. And we also know that childcare providers and employers really play a critical role in maintaining this support. So if a childcare provider can say, oh yes, I've been trained on breastfeeding, which is currently not a requirement of childcare providers in Colorado. But if she could say, yes, I've been trained on breastfeeding. I know we have supportive practices on how to be supportive of breastfeeding. Or your employer says, oh, we have a lactation room. Do you want to talk about how we can work with your break schedule? That is definitely very supportive and could help moms to initiate and continue breastfeeding when they decide to return to work. So in 2014, we did a survey of childcare professionals and all around the state, and we found overall there was a really positive attitude towards breastfeeding. So people were really supportive of breastfeeding. They said if they were to have a child ever again, even if they were 65, if they were to go back and have a child again, that they would breastfeed their children. But where we really found the information that was really the biggest gaps were in the storage and handling. They didn't know if they should wear gloves or not. They didn't know how to properly store breast milk or feed breast milk. They didn't understand completely the benefits. They really knew a lot of the benefits to mom, but not of baby. So it was kind of interesting. They didn't know how to properly read infant feeding cues. So a majority of the respondents actually said that crying was the first sign of hunger. And so that's definitely something we would want to educate on, that, we don't want baby to get to the point where they're having to cry to tell you that they're hungry, that they're showing all these other signs that they're really hungry. And then they also really felt like they didn't have any kind of influence over moms. They felt like moms had already decided that they were going to breastfeed or not, and they already decided whether or not long before they started in childcare. But the reality is that they actually can have a really big influence, and that they, in their advertising marketing materials, by saying they are breastfeeding friendly, that they do have breastfeeding babies that they support, that can be really supportive for a mom to decide, well, since my childcare provider is okay with this and is trained on this, then maybe I will continue to breastfeed. So we created an advisory committee, and through that we actually created we created 2 toolkits and a handout. So the 2 toolkits are essentially the same. They're for childcare professionals. One is for those that work in a center and focuses more around your staff and your employees and at the center level. And the other is for home providers or the family. So that can be shared with family, friend, and neighbor, with anyone who provides childcare for an infant. And then within those, and also as a standalone document, are a mom's handout is what we call it. But it's that tips for putting your breastfed baby into childcare. So like how to prepare your baby to take a bottle, how to prepare your breasts, make sure you're pumping enough, those kind of things. Spanish versions are coming soon, and then we also have trainings and posters that will be available. So generally the toolkits talk about kind of the overview of the benefits, general information. We do talk about baby behavior. Paced bottle feeding, which is really important for obesity prevention as well, is essentially treating the bottle like a breast. So since milk or formula, no matter what's in the bottle, comes out much faster from a bottle, it's trying to make baby take regular breaks like they would at the breast to kind of maintain, let them know, oh yeah, I am full, I'm gonna stop eating. There's also a self-assessment that the child care professionals can do to assess their own program to see how breastfeeding friendly they are, and lots of resources in there too. And then the mom's handout, I kind of already mentioned this, and it also talks about some of our state laws as well. So the action here would be really to share this with any mom who might be returning to work or school and starting their breastfed baby in childcare. Have them share, not just the mom's toolkit, but say, hey, take this toolkit and share it with your own childcare provider and kind of see where they are. Or look for a childcare provider who has been recognized as being breastfeeding friendly. There's several county level recognition programs that are available as well that you can look up to find a provider that's actually breastfeeding friendly recognized. And then there's also many trainings as well. So there's online trainings too. We have a train the trainer slide deck. So if local communities wanted to actually do a training on childcare, breastfeeding friendly childcare, you could take the train the trainer and then use the actual PowerPoint slide deck yourself to modify and provide the training in your community. There's also one on the professional development information system, which is where licensed childcare providers can go to receive continuing education credits. And then we also have put that same interactive 1-hour module now on CoTrain, which is kind of Colorado's training module platform. And all of those are linked on our website, which is breastfeedcolorado.com. So in the workplace, we know that we have several state laws. So we have 3 that are the main focus. Breastfeeding in public. And so that is a mom is able to breastfeed anywhere she has the right to be. And we have a workplace lactation accommodations. And so that means that employers have to accommodate and support moms in the workplace. And our law is stronger than the federal law, and we'll go into that in a minute. And then we also have a jury duty postponement. So any woman who is breastfeeding or any breastfeeding individual can postpone jury duty if they're breastfeeding for up to 2 12-month postponements. So why should employers accommodate? First of all, it's the law. There's federal law as well as state law on why they have to accommodate. We've also found that research has shown that those employers that have a lactation program, that it increases their employee satisfaction. It also increases their retention, and that really boils down to saving money, as well as the better health. So there's less absenteeism as well. So if an employer is supportive of breastfeeding, they get more people returning to work after they've had a baby, so they don't have to train a new person. They have more satisfaction in their job, so they stay at that job a lot longer. So after they've been trained, they have more staying power, which is good. And we also see a return on investment of 3 to 1. So if you make a lactation program, there's an average savings of over $1,500 per person in healthcare cost savings and other savings with an employer. So as I kind of just mentioned, this goes back to if over 90% of infants in the US, were breastfed, we would save over $18 billion in healthcare costs and over 1,000 lives as well. So there's differences in the Colorado state workplace lactation accommodations law and the federal law. And many employers are aware of the federal law. And so they'll think, oh, it doesn't pertain to me because I only have 4 employees or 20 employees. But the state law is essentially if you are an employer, so you employ 1 or more employees, then you have to accommodate. And the state law is also for 2 years, whereas the federal law is only for 1 year. You have to provide paid or unpaid reasonable break time. And so this can be mom takes her lunch break, mom takes her other breaks, and they just have to be reasonable. And maybe that's something that, maybe mom works half an hour extra at the end or the beginning of her shift to make up her time, but it's allowing her to take those breaks. They have to provide a private space that cannot be a toilet stall. So the private space does not have to be a dedicated room. It just needs to be a private space free from intrusion so that moms feel comfortable enough to breastfeed or to pump, and they cannot discriminate. And part of the federal law, since typically federal laws always kind of supersede state laws, they actually wrote it into the federal law that if a state law has stronger and more protection, that the state law is the stronger law and will take precedent. So for workplace lactation accommodation, we have several different resources. We also have a grant program that provides local public health departments with mini grant funds and other information that they can use in their own communities. Local coalitions really work on this, and there's a lot of momentum statewide. So a lot of the work can't really be done at the state level, at my level, with the Big P, because we've got the Big P policy already in place. It's trying to get those employers to know that there is this law, that there's a state law, and then how to actually implement it. And then once they've implemented it, do their employees even know that they have a policy and that they have a program? That was the other issue as well. I always like to use an example of a Walmart in Chaffee County. And so one of the people down there was hearing from a WIC participant that she wasn't being supported by her employer at Walmart. And so she would go to work and the manager said they couldn't provide her with a room or anything. Well, it turns out Walmart has its own corporate policy, but the store manager didn't know about it and didn't know how to accommodate. And so this person went in and just talked with the store manager, found out about the corporate policy, informed on the state law, and then just told them, okay, let's take one of the dressing rooms that's not used and convert it temporarily into a lactation space that this mom can use, and let's work with her schedule. And now they made sure that it's in their new employee training information and just post it on a sign in the employee break room, so that that information is now made aware to any employee who might come in and be breastfeeding or pregnant and thinking about breastfeeding. So part of that was through the Cancer and Cardiovascular Chronic Pulmonary Disease Grant Program. So that's Amendment 35. That's actually our tobacco taxes go to fund this pot of money that goes into grant funding. And so it's a 3-year grant cycle, and the previous 3-year cycle just ended in July, or at the end of June. And so that was the first time that healthy eating and active living strategies were even included. That was really due in a large part to the Affordable Care Act's implementation. Prior to this, the CCPD grant program kind of filled in a lot of the healthcare patient navigator holes that existed, but since the ACA came out, it really helped to kind of fill those holes, so they were able to expand it on more of this obesity prevention. And so because of that, breastfeeding actually became a strategy last time, and is the current strategy as well, this next 3-year grant cycle that will end in 2021. And so their focus is on the local level, and it's really focused on employers working one-on-one with employers in their community, working with childcare professionals one-on-one in their community. They also work to create public spaces. So if a mom is out at a mall or she's out at a public event, that there might be somewhere where she could go and breastfeed her child in private or pump. They also work to create continuity of care. So that really ties in with the baby-friendly aspect, so that there is that lactation support in the community that moms can access, and provide all those different local resources and find them and create lists even of the local resources, since those can change so quickly. It's really great to have the local be able to do this. And so we had previously 4 different grantees in the state, and that was Boulder, Chaffee County, Northeast, which comprises 6 counties in the far Northeast, and then the West Central Public Health Partnership, which was down in Delta, Montrose, Gunnison, Hinsdale, San Miguel, down in that area. Our current grant cycle is now through the Colorado Health Institute, who subcontractors are Denver, Jeffco, Tri-County, and Boulder. And then Boulder's also providing rural support to any rural local coalition or local public health agency or communities in any of the rural other parts of the state that need maybe strategic planning or support or some funds to print materials, the toolkits, those kind of things. And then Pueblo County is also another grantee this grant cycle that will be working in their community on lactation support. So Boulder, through the grant program, has created several really good resources. They have an employer toolkit that's specific to Colorado, and that is really useful to be able to provide to an employer to say, here's what you need to do, how to do it. They have a childcare toolkit as well that's really closely aligned with the state toolkit. They also have a mom's toolkit that's more comprehensive on breastfeeding in general, not just returning to work and going to childcare. And then they have the medical provider toolkit that I mentioned earlier. So the action here is really, if you have a mom or even if you're, never going to breastfeed, or if you're a man or anything, you could talk to your employer and say, hey, do we have a lactation policy? And what is it, and why don't we know about it? Or how do you tell your employees? And just talk to them and see how it's already laid out in your own employer. You could work to help create a space as well. You can share the toolkits and resources, and then really just try to connect with local coalitions or the locals that are working on this stuff if you really want to be involved. So these are some examples of how to accommodate a woman. So there can be from the full-blown multi-user dedicated space that you can partition with little wall and room dividers or curtains to make it kind of single multi-user. The one on the far left has a Symphony multi-user breast pump in it. There's a mini fridge. There's a sink for washing the pump parts. There's storage in there so mom can store and dry her pump parts. So that's kind of the bigger scale ideal multi-user for like a larger business. But then there's also temporary and flexible space. So it could just be getting a room divider and putting it in the corner of the break room or the corner of a conference room that's never used, or even a storage room, and just having signage so that moms don't feel like someone's just gonna walk in on them, and having some way to either lock the door or make it some kind of privacy with the signage potentially. And we know that breast milk, moms can let down and release more breast milk if she feels secure in the location. If she feels like she's gonna be walked in on something or is stressed, then she actually won't release as much breast milk. And then there's lots of kind of creative spaces. So, say she's a fast food worker, she could use the manager's office. If she works in a hotel or hospitality, she could use one of the unused conference rooms or unused guest rooms. Like I was saying, the dressing room in retail could also suffice, or a back room. A restaurant up in Boulder recently just had 2 pregnant employees that delivered and wanted to return to breastfeed. So they hung a wire and put a curtain up in the back corner of the storeroom. And that was going to just be their temporary breastfeeding space. And so they just use shower curtains essentially, or regular curtains. And then these bottom 2 pictures under the creative are kind of for outdoor use. So the one of them is they actually took a porta potty and converted it and just put a floor down and then put a chair and a table in there. And so that would require a battery operated pump. And same with the other one is pop-up tents that are used in manufacturing or in agriculture as well. So the last thing really too would be to get involved. So, the Colorado Breastfeeding Coalition is a state coalition that provides support, resources, lots of different connections. They also have events to try to help normalize breastfeeding, because that's one of the main goals of the Colorado Breastfeeding Coalition, is to normalize it. So the annual Breastival is actually coming up on August 26th. It's Sunday afternoon here in Denver. It's from 3 to 6 p.m. and it's the largest free festival for families in Colorado. And there's like free bounce house and balloon animals and face painting, and there's food trucks, and it's just like a lot of fun for families to come out. And the whole goal is to try to just normalize and educate on breastfeeding. They also are helping to host the Colorado Breastfeeding Conference, which is here at Children's, September 20th and 21st this year. They have an annual Rockies Day, or Day at the Rockies, where you get discount tickets, and usually an advocacy day that they work on with legislation. So the resources that I mentioned are some of the many different toolkits that are available that you could share with others. There's also community resources. So many of these grantees or local coalitions have developed community resource lists that'll list different places in your community where mom could get pump supplies, or where mom could get lactation support. WIC is another great, because part of the WIC whole goal is the referral system, and so they have a lot of great connections with their own community as well. And then the Office on Women's Health, which I actually showed in these pictures. A lot of these pictures, especially on the far right, are pictures from the Office of Women's Health. So they actually have an industry-specific link that you could go and find creative solutions for how to accommodate women that are industry-specific. Thank you, everybody, for being on the webinar and for being here today. I will take questions. Those are just some resources. I have a lot of links and such on my website, as well as the toolkits at breastfeedcolorado.com too.